Have you ever been told not to drink water while eating? Or that fruit should only be eaten on an empty stomach? Perhaps someone has warned you that spicy food always causes stomach ulcers, or that acidity simply means your stomach is producing too much acid. These are some of the most common digestive beliefs passed down through families, shared by friends, repeated on social media, and circulated through countless WhatsApp messages. But have you ever stopped to ask whether they are actually true? The surprising reality is that many of these popular beliefs are either completely false or only partly true. The real danger is not simply believing these myths. It is that they often delay the right diagnosis and proper treatment. Throughout my years of clinical practice, I have treated many patients who spent months following misleading advice, while the real cause of their digestive problems continued to worsen unnoticed. In today's video, I will explain 7 of the most common digestive myths that I hear from my patients. More importantly, I will show you what medical science actually tells us so you can make informed decisions about your digestive health. I encourage you to stay with me until the end because the final myth is still believed by millions of people every day, and understanding the truth could completely change the way you think about your digestive system. Myth 1. Fruit should only be eaten on an empty stomach. This is probably the most common digestive myth I hear. Many people believe that if fruit is eaten after a meal, it stays inside the stomach, begins to ferment or rot, and produces harmful toxins. Fortunately, that is not how your digestive system works. Your stomach continuously mixes food with digestive juices and stomach acid, breaking it down into smaller particles as digestion takes place. Food is continuously mixed and digested rather than remaining in separate layers inside the stomach. Whether you eat fruit before a meal, after a meal, or as a snack, a healthy digestive system is designed to digest it efficiently. If you experience bloating after eating fruit, the timing is usually not the real cause. Conditions such as irritable bowel syndrome, fructose malabsorption, or sensitivity to certain high FODMAP fruits are much more likely to explain those symptoms. Instead of worrying about the clock, focus on eating the right portion and choosing the fruits that suit your digestive system. That simple approach is far more helpful than following a myth that has been repeated for generations. Now that we have cleared up the first misconception, let us move on to 2 more digestive myths that continue to confuse millions of people and often lead them to make unnecessary changes to their daily habits. Myth 2. Milk causes mucus. This is one of the most common myths I hear from my patients, especially during the cold and flu season. Many people stop drinking milk as soon as they develop a cough, a blocked nose, or sinus congestion because they believe it increases mucus production. However, scientific studies have consistently shown that milk does not increase mucus production in healthy individuals. So why do some people feel as though they have more mucus after drinking milk? The explanation is actually very simple. Milk has a naturally creamy texture that temporarily coats the mouth and throat. This can create the feeling that your mucus has become thicker or more noticeable, but it does not mean your body is producing extra mucus. These are 2 completely different things. And understanding that difference can prevent unnecessary food restrictions. There is, however, one important exception. If you are lactose intolerant, drinking milk may cause bloating, abdominal discomfort, excess gas, or diarrhea because your body cannot digest lactose efficiently. In that situation, the problem is lactose intolerance, not increased mucus production. If milk suits your body and you do not have lactose intolerance or a milk allergy, there is generally no medical reason to avoid it simply because you have a cold, a sore throat, or sinus symptoms. Myth 3. Acidity means your stomach produces too much acid. This sounds perfectly reasonable, but it is only part of the story. Many people who experience frequent acidity actually produce a normal amount of stomach acid. The real issue is often that stomach acid is flowing back into the esophagus between the food pipe, also called the oesophagus, And the stomach is a muscular valve that normally prevents stomach contents from flowing backwards. When this valve becomes weak or relaxes more often than it should, stomach acid can flow back into the esophagus. Because the lining of the esophagus is far more sensitive than the lining of the stomach, even normal stomach acid can cause burning in the chest, sour regurgitation, or an unpleasant taste in the mouth. This condition is known as acid reflux. Understanding this difference is important because simply reducing stomach acid does not always solve the underlying problem. Frequent reflux may be linked to excess body weight, a hiatus hernia, delayed stomach emptying, smoking, large late-night meals, or lying down soon after eating. Identifying these contributing factors is often just as important as taking medication. If heartburn keeps returning, becomes more severe, or is accompanied by difficulty swallowing, unexplained weight loss, vomiting, or black stools, do not ignore these warning signs or rely only on home remedies. A proper medical assessment can identify the real cause, guide the right treatment, and help prevent more serious complications in the future. By now, you have probably realized that many digestive myths continue to spread simply because they have been repeated for generations, not because they are supported by scientific evidence. Let us continue by looking at two more misconceptions that often prevent people from understanding the real cause of their digestive symptoms. Myth 4. Spicy food causes stomach ulcers. This is one of the oldest and most widely believed digestive myths. For many years, people have blamed chilies and spicy meals whenever stomach pain develops. However, modern medical research tells us a different story. The two leading causes of stomach ulcers are an infection with a bacterium called Helicobacter pylori, commonly known as H. pylori, and the long-term use of certain pain-relieving medicines such as ibuprofen, diclofenac, and aspirin. These medicines belong to a group called non-steroidal anti-inflammatory drugs, or NSAIDs, which can weaken the stomach's protective lining over time. This does not mean spicy food has no effect at all. If you already have an ulcer or severe gastritis, spicy meals can irritate the inflamed stomach lining and make symptoms such as burning, pain, or discomfort feel worse. But making existing symptoms worse is very different from causing the ulcer in the first place. That is why you should never assume that spices are the only problem. If you have persistent abdominal pain, unexplained weight loss, repeated vomiting, black stools, vomiting blood, or a falling blood count, these warning signs should never be ignored. Simply changing to bland food while delaying a proper medical examination could allow a more serious condition to progress unnoticed. If you are finding this information helpful, please consider subscribing to the channel. Every week, I share practical, science-based health advice to help you separate medical facts from common myths and make better decisions for your long-term digestive health. Myth 5. Everyone needs regular colon cleansing to remove toxins. Social media is filled with advertisements promoting detox drinks, colon cleanses, and expensive detox programs that claim to remove harmful toxins from your intestines. In reality, your body already has an efficient and highly organized detoxification system. Your liver, kidneys, and intestines work continuously to process nutrients, remove waste products, and maintain your body's normal balance. Your large intestine naturally eliminates waste through regular bowel movements, so it does not need routine cleansing products to function properly. There are situations where bowel preparation is medically necessary, such as before a colonoscopy or certain bowel operations. In those cases, your doctor will prescribe a specific preparation for a clear medical reason. Outside these situations, routine colon cleansing has not been shown to improve health. In fact, some cleansing products may cause dehydration, electrolyte imbalance, kidney problems, or even injury to the intestines. Instead of spending money on products that promise to detox your gut, Focus on habits that are proven to work, eat a balanced diet, stay physically active, drink enough water, and seek medical advice if digestive symptoms continue instead of relying on expensive detox programs. So far, we have uncovered several digestive myths that have been passed from one generation to another without strong scientific evidence. Let us finish with the final two misconceptions, both of which continue to create unnecessary worry and confusion for many people. Myth 6. You must pass a bowel motion every day to be healthy. This is a belief that causes unnecessary anxiety, particularly among people over the age of 60. In my clinical practice, I often meet patients who become concerned if they do not have a bowel movement for a single day. Some even begin taking laxatives, herbal remedies, or so-called digestive cleansers, without understanding what a normal bowel pattern actually looks like. The truth is that healthy bowel habits vary from one person to another. Some people naturally pass stools 3 times a day, while others may pass stools only 3 times a week. Both patterns can be completely normal, provided they have remained consistent and do not cause discomfort. Constipation is not defined simply by how often you open your bowels. Doctors look at several important factors. Are your stools unusually hard? Do you need to strain excessively? Do you feel that your bowels have not emptied completely? Are you spending a long time on the toilet without relief? These symptoms provide far more useful information than counting bowel movements alone. However, a new or persistent change in your bowel habit should never be ignored. If you are over the age of 40 and develop ongoing constipation, notice blood in your stool, experience unexplained weight loss, persistent abdominal pain, or find that your symptoms continue despite maintaining a healthy diet, it is important to seek medical advice. Early assessment can identify the underlying cause and allow appropriate treatment before the condition becomes more serious. If you have learned something useful from today's video, please write gut health in the comments. It is always encouraging to see how many people are choosing evidence-based information over common myths. Myth 7. Drinking water during meals damages digestion. This is another myth that has been repeated for decades. Many people believe that drinking water during meals dilutes stomach acid so much that digestion slows down or becomes ineffective. Fortunately, that is not how your digestive system works. Your stomach is designed to adjust the production of digestive juices and stomach acid according to what you eat and drink. A small glass of water during a meal will not stop digestion or significantly dilute stomach acid. In fact, it can help soften food, making it easier to chew, swallow, and move through the digestive tract. The only time water may make you feel uncomfortable is when you drink very large amounts in a short period while eating, which can leave you feeling overly full or temporarily bloated. For most people, drinking moderate amounts of water with meals is completely safe. There is no need to avoid water because of outdated advice. Your digestive system is remarkably efficient and is designed to handle both food and fluids at the same time. As we come to the end of today's video, I would like you to remember one important message. Your digestive system is remarkably sophisticated, and many of the myths surrounding it simply are not supported by scientific evidence. Unfortunately, misinformation often spreads much faster than reliable medical advice. When these myths are repeated for years, they begin to sound like facts, even though research tells us a very different story. Today, we have separated facts from fiction by discussing 7 of the most common digestive myths. We learned that fruit does not rot inside your stomach simply because you eat it after a meal. Milk does not increase mucus production in healthy people. Frequent acidity is often caused by acid reflux rather than your stomach producing too much acid. We also explained that spicy food may worsen the discomfort of an existing ulcer, but it is not one of the leading causes of stomach ulcers. In addition, routine colon cleansing is unnecessary for most people. Healthy bowel habits are different from one individual to another, and drinking a moderate amount of water during meals does not damage your digestion. The most important lesson is not to become afraid of food or everyday habits because of information that has no scientific basis. Instead, learn to understand how your body works, pay attention to persistent symptoms, and make decisions based on reliable medical evidence rather than popular opinions or social media messages. At the same time, never ignore warning signs such as ongoing abdominal pain, repeated heartburn, difficulty swallowing, blood in the stool, black stools, unexplained weight loss, or a lasting change in your bowel habits. These symptoms should always be assessed by a doctor because early diagnosis often leads to simpler treatment and better long-term outcomes. Good digestive health is not built through expensive detox products, unnecessary food restrictions, or outdated beliefs. It is built through balanced nutrition, regular physical activity, adequate hydration, healthy daily habits, and seeking medical advice when something does not feel right. Small, evidence-based choices made consistently will always do more for your digestive health than myths that have been repeated for generations. If you found today's video helpful, please give it a like and share it with your family and friends. You may help someone replace long-held myths with accurate medical knowledge and encourage them to seek the right care when they need it. Thank you for watching. Until next time, take good care of your health.